Okay, folks, ready for some healthcare shakeups?
Always.
Buckle up, because we're diving deep into some news that's got people buzzing
Oh, yeah.
big time. President-elect Trump just announced his pick to lead the Centers for Medicare and Medicaid Services.
Interesting. Let me guess.
And it's a name you'll definitely recognize.
Okay. I'm intrigued. Lay it on me.
Drum roll, please. Dr. Oz.
Wait a minute. That Dr. Oz.
It's one and only.
From TV to leading CMS. That's a big jump.
Huge. From TV screens to potentially shaping the healthcare of millions,
This is going to be interesting.
to say the least. So we're taking a deep dive today into an article all about this surprise announcement.
Makes sense.
We're going to try to unpack what this appointment could mean for the future of American healthcare.
Sounds like a plan.
The good, the bad, and the
Sure.
totally unexpected. So first up, let's break down some key details.
Okay, shoot.
The article highlights that Dr. Oz will be working closely with Robert F. Kennedy Jr.
Kennedy. Okay.
You know, the one Trump appointed to lead the Department of Health and Human
Yeah,
Services?
you're right. HHS.
And this is where it gets interesting. Remember, CMS, which oversees Medicare and Medicaid, actually operates within HHS.
So they'll be working side by side.
Exactly. Think dynamic duo, but for healthcare.
Wow. That's quite a pairing. And it really highlights just how much influence this appointment could have.
Right.
I mean, CMS isn't just some random agency. It's responsible for programs that impact a huge chunk of the American population.
You're talking seniors, low-income folks, a massive amount of people.
Absolutely. Changes to these programs can have ripple effects throughout the entire healthcare system.
And speaking of massive again, this article pointed out something that blew my mind.
I'm all ears.
CMS controls a third of the nation's healthcare spending.
Whoa.
And get this, a quarter of the entire national budget.
That's a huge responsibility. So what's Trump hoping Dr. Oz will do with all that power?
Well, according to the article, Trump's got some pretty specific goals.
Like what?
He wants Oz to tackle what he calls the illness industrial complex.
Oh, yeah, I've heard that term thrown around. What does it even mean in this context?
That's a great question. Basically, it suggests that the current healthcare system actually benefits from people being sick.
Because the focus is on treating illness rather than preventing it.
Exactly. It's all about addressing the symptoms, not the root cause. And Trump wants Oz to flip the script.
Interesting. By incentivizing disease prevention and cutting waste and fraud.
Which sounds great on paper, right? But it makes you wonder.
Is it actually possible to shift an entire system's focus like that? I mean, there are a lot of moving parts.
So many. And how do you even measure the success of preventative care?
Right. And what happens to the industries that rely on treating illnesses? There are a lot of potential ripple effects to consider. But theoretically, focusing on prevention could lead to a healthier population and lower healthcare costs in the long run.
It's certainly a bold vision. And of course, Trump believes Dr. Oz will fight to ensure everyone in America receives the best possible health care.
That's a pretty loaded statement, though, right?
Yeah.
What does best possible healthcare even look like?
Yeah, best is pretty subjective, right?
Totally. Healthcare reform is such a complex issue with so many different perspectives. Some folks prioritize cost reduction above all else.
Makes sense.
Others believe that everyone should have access to healthcare, regardless of their ability to pay. And then there's the debate about the quality of care. What does it mean to provide the best care? And what role should the government play versus private industry? It's a minefield.
It really is. So let's shift gears for a second and talk about Dr. Oz himself.
Okay, sure.
The article mentions he has that medical degree from the University of Pennsylvania.
Right.
And of course, his long-running TV show.
Yeah.
Oh, and we can't forget about his recent Senate run.
Yeah, he's been busy, so he's got the medical credentials. But how does being a TV doctor prepare you for running a massive government agency?
Exactly. It's such a different world.
It is. On one hand, Dr. Oz's communication skills and ability to connect with a wide audience could be super valuable in promoting public health initiatives.
He does have that charisma.
And name recognition. That could help him get people on board with new ideas. But on the other hand, he has zero experience in government. And let's not forget some of the controversy surrounding his health claims on his TV show.
That's a valid point. Will his celebrity status help or hinder his efforts to reform healthcare? Can he navigate the political complexities of Washington and deliver on Trump's ambitious goals? It's a lot to unpack.
It is, and I think it raises some important questions for all of us listening.
Absolutely. Thinking about your own healthcare experiences, how do you feel about this whole thing? Are you optimistic about Dr. Oz's focus on preventative care? Or do those past controversies give you pause? It's a conversation worth having.
It really is. And as this story unfolds, I think it's important to pay attention to the specific policy changes that emerge from CMS under his leadership.
What will his priorities be?
Will he push for sweeping reforms or take a more incremental approach? Will he prioritize cost reduction or focus on expanding access? There's a lot to keep an eye on. So stay tuned, folks. This is just the beginning.
And who knows? Maybe the best possible healthcare is just around the corner.
Only time will tell.
Thanks for tuning in, everybody. This has been a wild ride.
It has. Until next time, stay informed and stay healthy.
And don't forget to keep thinking critically.
Always.
See you next time.
Bye.